But let's continue then to just look at all the vantage points ahead of those announcements. Of course, receiving your matric results, as we've also been hearing, can be a stressful period, bringing along with it anxiety about the future. You've heard the references around mental health. That's why we've now roped in Dr. Keitumetse Mashego, who is a clinical and sports psychologist. Dr. Mashego, very good afternoon to you, and thank you so much for your time. So you've been hearing, of course, that more than 920,000 candidates sat for the NSC examinations nationwide, and of course that is a national certificate, making it one of the largest national assessment processes ever undertaken. So one can imagine the nerves around this announcement. What advice, though, can you give the class of 2025 as they await the confirmation of their results, especially after just watching how the IEB students have been receiving their results today?
Good afternoon, and thank you for having me. I think it's best to just note to everybody who sat for those exams that yes, stress is there, but do know that the results do not define you, because I think matric is the culmination of sometimes minimum 12 years, and we feel like this is it, but do know that there is life beyond this. And I can imagine how stressful it is, but do know that you put in the work, and whatever happens, there is always options. University is not the only option. There is other avenues, there's TVET colleges, because if so many sat, you can imagine how many academic institutions we have out there. So also the parents to just show grace to these students who work so hard for this moment.
Absolutely. What are the signs, though, of distress among students that parents should look out for? And what should they do if they notice serious emotional or behavioral changes? Because even though the results haven't come out yet, you can already see those students that are taking it very hard, to wait for those results, particularly if they think that they didn't do so well.
Definitely, yeah. So stress is physical symptoms without the physical cause. Meaning, if you go to the doctor, you're not gonna find a actual physical cause for that stress, that symptom, and it's usually sometimes behavioral, meaning someone will act out of character. So someone who's withdrawn, suddenly they are very restless, very busy, very talkative, and it can be the other way as well, where somebody who is usually part of conversations, they're just so withdrawn, they're sleeping, they're not eating well, and also physically they can get headaches that don't have any physical cause, stomach problems, sleeping problems, eating problems. So those are the things that parents should look out for. And also what they say, the students or the scholars should be, verbal about something, and they must be, either verbalizing that they are worried. So I think parents or caregivers should just comfort them in this time so that they, are able to remain calm and know that they are loved in spite of the outcome. Because I think most of the scholars, the reason why we've got sometimes suicide incidences or ideation is because they feel like they have failed as human beings. So I think the caregivers really should stress to the scholars that this is not the end. Whatever happens, we're going to handle it together so they don't feel so alone.
Yeah, absolutely. And I mean, I would imagine the same message then would absolutely apply, for those who didn't make it and actually get their results later tonight. I mean, how it is important, I would imagine, to help them understand that the future success is not defined solely by their marks. But then at the same time, Doc, you also have those that have made it but can't get placement. And that, again, produces that anxiety. And the reality is, of course, that not all institutions will be able to accept all those that are qualified, to enter that space.
Definitely, we have seen that happen. And I mean, if so many have said this year, and we've got, the same number of institutions we've had, they're not growing the same way in which the people who are sitting down for the exams. So really, they can be that. But I'm always of view that, you can study that skill, because unfortunately in South Africa we look down on certain professions or certain skills, things you can learn at a TVET college, for example. So I'm of view that yes, if you do not, a dream delayed is not a dream denied. So do still go for it, but in the meantime, find that skill, see what it is that you can do in the meantime, that you can harness that skill. And also parents should understand also that university is not everything, right? There is other options out there as well that they can look into in the meantime while they're still trying to apply for that course. And also there's courses, we look upon medicine, for example, and lawyer law degrees as the ultimates, but there are other degrees out there that students can actually look into, that gives them the skill where they can start actually to work sooner than what they will do when studying for a degree.
Yeah. As we wrap up our conversation, I mean, we're also listening to, of course, experts speaking around these results, but also placing a lot of emphasis on mental health, not only for students, but also for educators. There is increasing global focus on youth mental health, specifically as you've been seeing, throughout the years. How important then is it for the education system in this country to strike that balance, between academic performance, but also emotional well-being?
We truly have a crisis when it comes to the education sector. The districts needs to be involved, whereby they're bringing in multidisciplinary people such as myself, meaning the mental health specialists, the social workers, because we've got so many social ills that impact the students. And when the students go to the schools, they then project or they harm the teachers sometimes. So the teachers are also under pressure. So we really need to, government needs to step up the game when it comes to holistic interventions, and not just the private schools, but also the public sector schools. Yes, ideally you should have a counselor for each school, social services for each school, but that is not ideal in our country. But we can maybe have assigned counselors for a number of schools, maybe in the district, for example, so that there's continual screening for those who are at risk because of their social circumstances or academic performance, and also to support the poor teachers, because they are there doing the work. They've got lots of numbers, some of them in the classrooms. They're not coping with their own personal issues, never mind, what happens in the classrooms, because those children come sometimes with social issues. They haven't eaten, and some can be a bit violent. And you can imagine now trying to manage about 90 students at a go who are all struggling with something. So there's really a need to bring in social services and mental health services for the schools to intervene when it comes to children, but also the teachers as well. Screening, preventative management, and also if there is already those who are struggling, to assist them so that they get the help that they need.
Absolutely, Dr. Mashego, thank you so much. We really do appreciate your time. Dr. Keitumetse Mashego is a clinical and sports psychologist there.